Hello everyone, just here tonight to talk to you about nitric oxide abuse in the emergency department. It's certainly something that's having a steady rise, and we are seeing it more prevalent of a drug of abuse in Western Australia, and these cases are presenting through to emergency departments right throughout WA, and certainly we have seen this locally, a few more cases of late at Charles Gardner Emergency Department. So why are people abusing nitric oxide? So it's recreationally abused for its dissociative and euphoric effects. We know that nitric oxide used in medical controlled situations is a really effective analgesic. We use it in maternity wards, we use it for minor injury management because it does disassociate the patients. But these patients are using excessive doses of nitric oxide to get this euphoric effect daily. And that's when they start to run into trouble. Increasing use, it certainly doubled between 2018 to 2019, and it's still on that steep curve where patients are still abusing this quite frequently. And it's often referred to as NANGs or whippets when they're ingesting these nitrous oxide canisters. And as you can see there in the picture, like people who get the big canisters of nitric oxide and they inflate balloons with it and they huff the actual nitric oxide in through these balloons or through the small canisters. So it's relatively cheap and easy to get. And you can see there you can get 3 massive canisters of nitric oxide for about $112, which is huge. Or you can see the small the NANGs, which you can buy. I just Google search this on eBay, and you can get about 100 of them for about $52. So it's quite readily, easily to get. And so nitric oxide, those small canisters, are used for making whipped cream. So a lot of chefs use them and stuff, but it is quite easy to source these off the internet and certainly in shops and supermarkets. And we're not alone or isolated in Western Australia in dealing with this problem, and it's a massive problem around the world. The UK last week actually banned the sale of nitric oxide. It's now illegal to actually sell it in supermarkets or stores or import it into the United Kingdom. So there's big fines and even jail terms. So it's been classed as like an illicit substance over there. So the reason why we worry about this so much is the pathophysiology behind excessive nitric oxide use is basically it causes the oxidization of the cobalt ion in vitamin B12 and it renders it inactive. So this leads to functional vitamin B12 deficiency even when they've got normal blood levels of vitamin B12. So without vitamin B12, your homocysteine, which is an enzyme, is unable to be converted to methionine. And so this actually prevents myelin proteins from developing and protecting your spinal cord. And this results in demyelination of both your peripheral and your central nervous systems. So in the spinal cord, there is a predilection for demyelination of your dorsal columns. And so this leads to this subacute combined degeneration of the spinal cord. When we look at the peripheral nervous system, it causes ischemia. And this has been suggested as another cause of the actual neurotoxicity that these patients get. And it's also a direct effect of the vitamin B12 deficiency. So it has quite potent toxicity in abuse actually on your central and your peripheral nervous system. And some of this can be actually irreversible. So when these patients present to the emergency department, some of the acute presentations that we may see from NANGing is they may present with seizures. They can also present with paresthesia, proprioception lost. They have quite unsteady gait and ataxia. They can have this global weakness in their limbs. Cognitive decline has been reported, and they get autonomic dysfunction as well as headaches and other non-specific symptoms as well. Quite often, though, they can present with psychiatric symptoms as well, and we feel that this is going to occur secondary from your demyelination of your cerebral white matter, and so they can present with psychosis, mood disorders are commonly reported, and we also see signs of irritability, paranoia, delusions, and hallucinations that can occur. The chronic effects is what we really worry about because they get this peripheral and CNS demyelination. And there is an MRI that you can see, and that shows that they've got demyelination of the spinal cord. So this is where they're presenting with this really poor motor and sensory loss. So they have proprioception loss, they have an ataxic gait, and they also have vitamin B12 deficiency. Our colleagues over at Royal Perth have been looking at this quite closely over the last few years. Dr. Jess Sordenstrom have done some quite in-depth studies looking at patients presenting through their emergency department with nitric oxide abuse. And you can see some of the actual cases there are quite concerning. So the first case is a male. He was using about 100 nangs a day over a few months. He presented with leg weakness, pain, unable to walk, so an ataxic gait, swallow and incontinence problems, and he had a hospital length of stay of up to 65 days. The next patient was using up to 300 nangs per day for a 3-month period, and he presented with hallucinations, paranoia, and being unable to walk. And you can see there, some patients are using between 100 to 300 nangs a day, and they all present with this ataxic gait, peripheral signs of numbness to their legs, pain and leg spasms, but they also have some of the psychiatric sequelae that goes along with it as well. Our colleagues over at Royal Perth have come up with a flowchart for us how to actually manage patients that are presenting to the emergency departments with the side effects of nitric oxide abuse. So the first thing to do is in your acute assessment is you need to take a good history. So you want to know the duration of use, the number of canisters they're using today. Look to see what risk factors they've got for vitamin B12 deficiency, what symptoms they're having. Remember that they're at risk of associated trauma with this as well. You need to do a really good neurological exam on this. So you want to assess their cranial nerves and upper and lower limb strength and proprioception. Assessing for ataxic gait through Romberg test and gait assessment. You also need to assess for the neuropsychiatric type symptoms as well. In your investigations, we're going to do a full blood count on these patients. We're going to do vitamin B12 and folate. We're going to measure homocysteine and methionamic acid levels as well. And in those severe cases, we're going to consider referring them for an MRI of their spine. Treatment options, so patients with mild symptoms of nitric oxide abuse, so a recent binge or the asymptomatic, it's good to try and prevent, so referring these patients to drug and alcohol, discussion with toxicology about counselling them over cessation of nitric oxide. We can give IM vitamin B12 injections and then they get discharged home on oral vitamin B12. For those that are presenting with moderate symptoms, so subjective neurological or psychiatric symptoms, we're going to do counselling as well for harm minimisation. Once again, it's about replenishing their vitamin B12 stores, so IM and oral vitamin B12. We can give these patients PO methionine, so 1 gram TDS for 2 weeks. It's good to discuss these patients with the toxicology service, and they will need psychiatric review depending on their psychiatric symptoms that they can presenting with. And some of these patients may require a psychiatric admission, but they can be safely discharged from a neurological point of view if they're safe mobilising and self-caring. But they should have follow-up with GP and certainly to try and minimise further harm and use of nitric oxide. For those that present with quite severe symptoms, so really objective neurological deficits, so ataxic gait, stumbling, shuffling gait, plus or minus psychiatric symptoms, we're going to treat them with the IM vitamin B12, the methionine, put them on a complex B vitamin as well. really going to have to do intensive counselling for harm minimisation, discussing them with toxicology and the neurological service because they may need admission for an MRI and if they've got significant psychiatric symptoms, then they should be discussed with the psychiatry service as well. And these patients would generally get admitted under a neurological team, or they may get admitted if it's purely psychiatric symptoms under the psychiatry teams. But we need to appreciate all these symptoms that they may be presenting with and arrange appropriate follow-up and disposition for these patients or referral to inpatient specialties for management. So the take-home points that I want to leave you with is that we need to screen and look for patients that are presenting to ED that could be abusing nitric oxide. So if they're presenting with neurological or psychiatric sequelae, always keep this in your differential and ask about, are they abusing nitric oxide? You want to look for ataxic or the neurological signs, so decreased proprioception, ataxic gait, those sort of things. And we need to appreciate the psychiatric sequelae that comes with nitric oxide abuse and make sure that we're doing appropriate safety netting and management of these patients in the emergency department. Thank you, everyone.